Hey guys, Dr. Davenlin, board certified laser dermatologist. Today we'll be talking about PIH, post-inflammatory hyperpigmentation, or the marks that you have after acne's gone or when acne is there. So by definition, PIH or post-inflammatory hyperpigmentation can refer to, number one, red marks, but it can also occur with brown marks. So a lot of, I guess, the classification has been centered around whether they're brown or whether they're red. Does it make a difference? Yes, it does, because we use different devices, different techniques, and different lasers to treat those. I'll go through that probably around mid-segment of this. But how do you actually decipher between scars, actual scars which are indented, compared to vascular or pigment changes? That's very important because the management is very different. And the way you do it is through angle lighting. So you put an angle of light, incidental light or tangential light, and if you can see contour changes, then you actually have true scars, yeah? But look, it's debatable because it's still in the classification of pigment changes. A lot of people, including dermatologists, still classify that as scars. I do believe in that, but the treatment is very, very different. So the main thing we've got to do is prevent that. So how do we prevent PIH? That's the most important, because once you get PIH, here are the stats. So 80% of PIH occurs from mild to moderate acne. So not bad acne, not cystic acne. The majority of PIH occurs, 80%, yeah, occurs from grumbling acne. That's mild to moderate over the years, over the months. That's the first thing. The second thing is that when you get PIH, it can hang around. So 50%, that's 50%, half of PIH hangs around for a year. 25% of PIH hangs around for 5 years or more. So that's a huge stat, yeah? And the whole idea is to prevent that because, you know, like they say, prevention is so much better than the actual treatment itself or the cure. So how do you prevent it? So first of all, look at the people who are actually prone to PIH. Ethnicity, yeah? So if you're darker you are, the higher the chance of PIH. So patients who are Asian ethnicities, for example, Latinos, African Americans, the PIH rate increases with your skin type. So chances are, if you've got type 1, type 2 skin, fair skin, look, the chances of you getting PIH is slimmer compared to someone who has darker skin type. So those are the number one risk. Yeah. Number two, sun exposure. So if you get more sun exposure compared to someone whose sun protects, you're going to have a high incidence of PIH. Thirdly, inflammation. So we talked about inflammation, but even mild to moderate acne where people actually pick. So for example, females, yeah, adult female jawline hormonal acne. Because someone picks at them, it increases the amount of trauma to the skin, stimulates your melanocytes, that together with a little bit of light, that can make it worse. Fourth, the products you use, yeah, it's very important because you do not want to inflame your skin. If you have acne, yeah, the whole idea is to have precise treatments, but not to keep applying stuff, because if you keep applying stuff, it can lead to inflammation. Classic example of someone uses too high of a concentration of something like benzoyl peroxide, yeah, or triclosan, or keeps layering products on. That's where the incidence of PIH increases. So you want to actually apply something, but you want to apply something that's very, very specific to the acne and not irritate your skin. So things like retinol, retinoids can help. Another good clue to help prevent, especially people who pick, are those simple hydrocolloid dressings. Yeah, those little dressings that you put on that stop, you from manipulating and picking your acne. So hydrocolloid dressings actually help your skin heal up as well, yeah, because they contain a dressing, and the dressing actually promotes good wound repair and good skin healing. So that's very important. If you pick hydrocolloid dressings, awesome. You can buy them for, look, realistically, they're probably about 30-40 cents each, and they go up to about $2 each. So it's a good way to save your skin. So when we talk about PIH, let's talk about the treatment options. So I'll start from what you can try over the counter, and then I'll proceed all the way up to what I use or how I treat PIH. Yeah. So the simple things, like I said, treat your acne. The most important, treat acne early, treat acne effectively. So the chances of scarring is proportional to the time of control. It's not what you use or what you try. It's the time taken to absolute control of your acne. So be guided by your dermatologist. I've done lots and lots of things on acne, on how to treat acne OTC over the counter, which can be found in my Instagram links up there, right? So treat acne early, treat acne effectively. That way you reduce the chance of PIH. Let's say you do have skin color changes from old acne lesions. What can you do? First thing, like I said, decrease your irritants, use a normal cleanser, use a gentle cleanser. You don't want to irritate the skin. That's the first thing, yeah? You want to prevent, we talked about that. Thirdly, you want sunscreen. Now, the sunscreen, I've got heaps and heaps of questions, especially on my Instagram, yeah? What sunscreen is best for acne-prone skin? The answer is that, generally speaking, physical sunscreens, things like zinc oxide, titanium dioxide, or light sunscreens, yeah? Sunscreens which contain a high factor, but they're non-comedogenic. In other words, they're the ones that you use day in, day out, and they don't cause a sticky, greasy feeling. Generally speaking, you'll be right for acne-prone skin. Now, if you start using the really thick sunscreens, things like, for example, Neutrogena, yeah, they make good sunscreens, but they're also pretty thick. The other sunscreens, for example, Sunsense and Banana Boat. So if you're using those sports sunscreens, you're going to get much better protection, but the flip side is that it can be comedogenic, can be acne promoting, yeah? So find the right sunscreen for the right job. I recommend, for example, zinc oxide, which is found in invisible zinc. The other one which I like is La Roche-Posay with the Anthelios range. Depending on your country, they do have chemicals, and they also have physical blockers in it, yeah, titanium dioxide. So it depends on which country you're living in. Find the sunscreen that you like to use it. Okay, so when it comes to pigmentation, what can you do at home to treat pigmentation? The first thing is to use simple retinol. So what retinol would you use? Really depends on you, what you like to use, yeah? Because retinol nowadays is pretty cost effective. You can buy things from as little as $5, and you can buy even, things like Murad or SkinCeuticals or Environ. Those, I guess, retinol products are a little bit more expensive, about $100 odd. Are they different compared to something which is like, $5-10? At the end of the day, the ingredients are very similar, but the formulations are very different. So you got to make up that choice. You can try it. If you're in the US, keep flogging adapalene or Differin because it is over the counter. It's a second generation retinoid. In Australia, it's prescription based. So if you're lucky enough in the US and in some places in Europe, if you can get hold of adapalene or Differin, by all means use that. Because that can actually speed up your resolution of your pigment as well, right? So retinoids is number one. Number two, if you can get hold of ascorbic acid, yeah, which is vitamin C, because ascorbic acid, it does a lot of things. It can help repair your skin. It's an antioxidant, but it can also decrease the enzyme or activity of the enzyme which produces pigment because it's a tyrosinase inhibitor. So ascorbic acid, you might want to start with 10%, 15%, and go up to 20% as tolerated. So that's my number two. Retinol number one, ascorbic acid number two. Thirdly, what I like is niacinamide, which is vitamin B3 because it's anti-inflammatory. It's a pretty weak pigment inhibitor. In fact, it's probably negligible compared to vitamin C or vitamin A. So it's an anti-inflammatory. But if you do have inflammation, ongoing inflammation, subacute acne, certainly the vitamin B3s can be useful. So we go to other pigment inhibitors. You can buy lots of things over the counter, things which are very expensive like Lytera, Meloderm, Melorase, Melocream. They all are pretty XC, yeah? And do they offer a superior benefit compared to, between them? The answer is no. Some patients prefer Meloderm, some prefer Melocream, Melorase. The Lytera, they all contain botanicals, yeah? So it's an abstract or extract of certain botanicals. So if you're looking at ingredients to inhibit your enzyme, you're basically looking at things like licorice, arbutin, you're looking at citric acid, alpha hydroxy acids, you're looking at salicylic acid. They're gentle exfoliants that can reduce pigment. And then the botanicals, so things like bearberry, for example. All of these ingredients can be found in various concentrations in pigment creams. So do I like anyone in particular? I probably like kojic acid. It's been used by a lot of dermatologists. The problem with kojic acid is after the 2% concentration, it can be irritating. So anything between 1 to 2% is probably the sweet spot. Kojic acid can be combined with a lot of other products. For example, can be combined with hydroquinone. So if you have access to another bleaching agent called hydroquinone, by all means you can try that. Generally speaking, the concentrations are about 2%. So by regulation, they've maximum ceiling is about 2%. all the 3, 4, 5, 6, 7s, and they're all prescribed by dermatologists. So if you can get yourself 2% hydroquinone, something like Superfade, because it contains salicylic acid together with hydroquinone, and that's safe to use. So you can use that in your spots. You might want to try 3-4 nights per week. If there's no any redness, burning, stinging, irritation, flakiness, you can increase the use as well. So what else can you try from a pigment point of view? So we've talked about the A, the B's, the C's, the hydroquinone, the ascorbic acid. We can talk about face acids, yeah? So things like alpha hydroxy acids and beta hydroxy acids. The beauty about BHAs and beta hydroxy acids is that they're anti-inflammatory as well as an acid, so which means it can help exfoliate. But a BHA, because of the nature, goes into your lipid glands or your oil glands or your sebaceous glands a lot better than something like an alpha hydroxy acid. So BHAs can be used as a wash, and that can exfoliate your skin, decrease inflammation. So certainly for acne-prone skin, that's great. So pick very carefully between a B and an AHA, yeah, because you don't want to use both of them because that can cause irritation. I'll go through a few exceptions because there are a couple of skincare products out there which contain BHAs and AHAs, but the pH is a little bit higher, so it doesn't irritate your skin. So and when we swap down to AHAs, so what can you use? Yeah, so you can use something like a lactic acid or glycolic acid. So start off something pretty conservative between 5 to 10%. Glycolic acid, you can start around 10%. It goes up to about 15%. Neostrata makes good glycolic acids. But like I said in other videos, there's a lot of skincare companies now, including The Ordinary, Inkey List, and a lot of the other cost-effective companies making a lot of glycolic acids. So when we talk about combination BHAs, AHAs, there's really one standout. In my opinion, there's only one standout, which is basically the drunk elephant. That's, in the scheme of things, I don't think it's that expensive because you're not using much of it at all, and you're using it probably 2 or 3 times a week. So, you're looking at between $60 to $70 Australian dollars for the actual product itself. But generally speaking, that's going to last you about 6 months. Be careful though, because that's a very, very strong product. It contains beta hydroxy acids together with alpha hydroxy acids as a face wash. Great for acne-prone skin, great for pigment, but once again, be careful with that. So how should you go about treating PIH? Yeah, I've given you so many selections of things. Yeah, it's very important to actually pick and choose 1 or 2 products and then gradually add that in. So can I suggest one of the following? You start off with obviously the best sunscreen you can buy. Yeah, you can start off with a Banals moisturizer and a Banals. So in other words, nothing added. Something like, for example, this. Yeah. The Ordinary. If you don't break out on this, there's no cheaper moisturizer in my opinion with hyaluronic acid than this. It's pretty cheap, yeah. So don't spend your money on a expensive moisturizer nor an expensive cleanser. You want to use a very, I wouldn't say cheap, but you want to use something which is benign, something with very little additives and no fragrance, yeah. So you start off with that. Start off with the best sunscreen you can afford, and then pick something, yeah. Pick, for example, if you have sensitive skin, you might want to omit the C, but you might want to start in something like a low-dose retinol or niacinamide. Yeah, it's safer for vitamin B because it's anti-inflammatory. But if you got sensitive skin, you might want to start off something like 0.5% retinol rather than a retinoid. When your skin tolerates that, you still have pigment, where can you go? You can add the vitamin C in ascorbic acid, something like a 10%. If you can tolerate that, you can go up to 15, and you can tolerate that, you can go up to 20%. If you've got sensitive skin and you can't tolerate the C's generally, yeah, and you can't tolerate the vitamin A's, azelaic acid is a very good option. Azelaic acid is a very benign treatment. Yeah, in other words, it should not give you skin irritation. The allergen rate, the chances of it causing allergic contact dermatitis is very low. So something like 10% azelaic acid up to 15% azelaic acid. So that's a weak tyrosinase inhibitor as well. If you can tolerate all that, you still have pigment, what can you try? Give you a selection. So you can go for the more potent tyrosinase inhibitors. So something like, for example, hydroquinone, 2%. So pick that. Or if you go, look, I want to go natural, pick something like arbutin licorice. So one of your mellow creams, yeah. Or one of the creams that contain the botanicals. If you still have pigment and you've tried all of that, before seeing a dermatologist, you might want to try something like kojic acid, yeah? 1 to 2%. You can buy these in formulations. Koji-san makes it's an okay one, yeah. If I'm not mistaken, it's a Japanese brand. But yeah, you can buy that for 20-30 bucks. It doesn't tell you the concentration. I suspect it's somewhere around 1-ish% because the rate of contact dermatitis for anything above 2% is much higher. So kojic acid. Now, if you're really struggling with acne scarring and post-inflammatory pigment, and you've tried everything else, that's when the dermatologist can come in handy. Yeah. So when you're talking about red marks are usually easier to treat compared to brown marks. So for red marks, we use things like vascular lasers. So vascular laser, generally speaking, within 2 to 3 treatments, your red's gone. Generally speaking, it's easier, much easier if you have pale skin, in other words, type 1, type 2 skin, compared to someone like myself with type 3 plus skin. Because for patients with lighter skin types, we can go in harder, we can cause a little bit of pigmentation, in other words, purpura, bruising. So we can deliver the laser in a short pulse duration, we can deliver high energy settings, we can cause a tiny bit of bruising, maybe for 2-3 days. But generally speaking, 1 or 2 treatments, we can get most of the redness out, with vascular laser. So if you don't have access to vascular laser, what can you use? You can use IPL as well, intense pulse light or broadband light with the red light, with a vascular filter. So anywhere between 532 to 595 type filters. And generally speaking, within 2 to 4 treatments, we should be able to get the red. Now, the brown bits, or the true PIH, or post-inflammatory hyperpigmentation, that's a little bit more difficult to treat compared to the red. Now, dermatologists, generally speaking, would put you on a pigment laser. So for patients with PIH, with true PIH, with very little in the way of contour changes for the scarring, your choices are pigment lasers. The pigment lasers we normally use are nanosecond, but we can also use picosecond lasers. Even with, I find PIH probably the hardest type of scarring to treat. It's extraordinarily hard because we can't hurry it up. So we can't use a high fluence, we can't use aggressive treatments, because all we do is we make the melanocytes more angry, we pee them off, and then they chuck out more pigment. So you have to be very, very gentle with your settings with your laser. So things like nanosecond lasers, you can do them every, realistically, to do nano, you should probably do it once every 2 weeks at minimum. At maximum. You don't want to decrease the frequency, because if you do it too frequent, it can knock off your melanocytes. So generally speaking, most of the derms would go, do 5 to 10 sessions over a period of something like 10 to 15 weeks or 10 to 20 weeks. Even then, the parameters that we use have to be very, very low. Pico lasers, can they work? Yes, I think they actually confer they have a bigger advantage over nanosecond. I used to use a lot of pico for PIH. They're more aggressive compared to nanoseconds. They cost more because the laser, when it first came out in 2015, was upwards of $250,000 US. So that's the reason why I guess it's so exy. Now the price have come down. So and there's a lot of different lasers there. The Pico Shred, the Pico Way, Pico Plus, Enlighten. There's many devices out there. So pico lasers certainly can help. In my opinion, they probably speed things up. I wouldn't say twice as quick, but they probably speed things up by maybe about between 30 to 50% compared to nano. The flip side is that if it's too aggressive with the treatments, the pico can actually cause PIH as well. So moving from these lasers, what else can we use? Certainly fractional laser, but you want to use a very gentle fractional laser. So it's not something like a 1927 either diode or thulium driven. That's a good wavelength, in my opinion, for PIH. That's fractional. IPL, look, unless you're really trained and do a lot of IPL, generally speaking, IPL makes things worse. Certainly this new IPL devices, fractionated fluorescent IPLs. I don't have one. I don't have much experience. In fact, I have no experience with that, but it's in the literature to help with pigment because they fractionate the light itself much like they fractionate laser. So with derms, generally speaking, we start off with the lasers, the pigment lasers, then we go to the fractional lasers. We can consider peels. The peels that we use are a little bit higher strength compared to your home peels. So most of us would start off with something like a alpha hydroxy acid, glycolic acid, 15 to 20%, then step up to 35%, then 50%, and if tolerated, 70%. But you've got to be very careful that you don't cause paradoxical PIH by giving a chemical burn. The other option, and I know that a lot of them are using, for example, in Asian countries, salicylic acid. So because it's anti-inflammatory, it has pigment reducing properties as well. So salicylic acid, we start off with something like, it depends on your skin type, something like 10%, you can go up to 15, but all the way up to 30% is pretty safe. So that's self-neutralizing sal acid with a bit of pseudo-frosting, conducted maybe once every 2 weeks or so. That can help with pigment. Then we talk about other type of peels, the trichloroacetic acid peels, TCA. Once again, with TCA peels, you shouldn't go too high too soon. So I like using something, if I were to use it, I'd probably use something like 15%. Yeah, most of my TCA peels are just in the TCAs, or TCA upwards of 35%. But if you're treating pigment, especially if you are new to the game, probably start something like 10-15%, repeat every 2 weeks. Make sure there's no widespread frosting. If you have epidermal sloughing, you've gone too far, your whole epidermis come off. So what you want to do is just have a little bit of pinpoint frosting, if that, or a little bit of redness. So that's your trichloroacetic acid. Another good peel which I like and I use a fair bit is your retinoid peel. So we're talking about retinoic acid. Concentration anywhere between 0.5% all the way to 5%. So my favorite formulations are usually hovering around 2%. That is an awesome peel because that can give you exfoliation of your epidermis. So if you have pigment kicking out, your epidermis can exfoliate that. But it's also great because it can help with collagen stimulation and also reduction of your enzyme tyrosinase inhibitor, especially at that concentration. So these are all options that dermatologists use. So remember guys, when we're treating PIH, it's extraordinarily difficult. Unlike, for example, a box scar where I can fully ablate, or when you have a linear scar or an ice pick scar, which you can punch excise, or you can actually excise, or you can do something like a high concentration TCA. For PIH and acne marks, it's extraordinarily difficult because we've got to respect your physiology, you've got to respect time. Now, if I can give you a take-home message, is this: the biggest mistake I see anyone do is not to treat active acne, because if it takes you 1 year to resolve your PIH, and if you get any new lesions within that year, guess what? It's going to take you possibly another year to get rid of those. So if you're close towards the end, let's say at the 9 or 10th month mark, and your PIH is fading, and then you get new lesions, you're back to square one. So if you are prone to PIH, by all means, treat acne aggressively. Guys, I hope you liked that video. This is a topic which I'm pretty versed in because I do this day in, day out, treat acne scars. But these are little hints of what you can do at home. And most patients don't need to see me for PIH. Yeah, my dermal therapists and my nurses, together with my colleagues, are very well versed in that. So even though it's hard to treat, if you take the necessary steps, the results are pretty good. And there's hope for everyone. So guys, I hope you liked that video. One new video every week. By all means, like, share, comment, and I'll see you next week. Thanks for that, guys. Bye for now.